Osteoarthritis is the most common form of arthritis and leads to pain when a joint is moved. Conservative treatment measures should always be used first when trying to find relief. This is in order to avoid medication side effects. This is Dr. Alan Jacobs, and I want to mention some of the medications and treatments that can be used. There are no medications that can cure or prevent osteoarthritis, but the treatments can help reduce your symptoms. There are treatments you can try yourself, including various liniments and also tablets of acetaminophen, which is also known as Tylenol. Be careful to read the instructions on the label so that you do not take too much of it. Acetaminophen is considered the safest medication for pain. If there is not enough relief, try ibuprofen, which is also known as Advil, or naproxen, which is called Aleve. Again, follow the instructions on the label, and if you have significant health problems, better consult your physician first. If these don't help, the prescription version of these arthritis pain medications, called the NSAIDs, may be given to you by your physician. As this slide shows, there are many to choose from. Not one of these can be stated to be better than the other. A few can be used just once a day, and others are used 2 to 3 times a day. It may be worth trying several of these to decide which one may suit you best. But the NSAIDs may have side effects, ranging from a burning stomach to an actual stomach ulcer, changes in kidney function and increased blood pressure, liver reactions, rashes, hives, asthma, increased bleeding, especially when people take Coumadin, also called warfarin, or Plavix, and also increased fluid retention called edema. The risks of these medications goes up with age and the number of medical problems. Very often, plain prescription pain pills work better and are safer than the NSAIDs. These pain pills may include tramadol, also called Ultram, propoxyphene, also called Darvocet, and hydrocodone, also called Vicodin or Lortab. If injection therapy is done correctly, it should not cause pain. As you can see from this slide, almost any joint can be injected, and it is therefore a very versatile form of treatment. The most common joint that is injected is the knee. Some joints may contain a large quantity of fluid that may also cause pain, and removing this fluid by a needle aspiration may quickly reduce the discomfort. Removing the fluid is best done under the guidance of an ultrasound machine. The fluid can then be sent to a lab for diagnostic help if needed. Joint injections are very safe when compared to taking oral medications and often reduce the pain in 24 hours. For most joints, the material that is injected is a combination of an anesthetic like lidocaine combined with some form of cortisone. These types of injections have been used for decades and can be repeated every 3 months if needed. If cortisone is given into the knee and does not help for 3 months, then a special injection can be used that is often called joint grease or joint oil. The special material may often last 6 months or longer. There are various products that are now available. These products can vary in terms of how many injections are required and range from a single injection to 3 weekly injections to 5 weekly injections. If the pain and lack of function is severe and constant, the last resort is a joint replacement. The knee and hip are the joints that are most often replaced in order to be able to walk again. Unfortunately, recovery can be slow and there may be complications. This is Dr. Alan Jacobs, and I would suggest that you discuss all of your treatment options with your physician in order to decide what best suits you.